And so does this typically lead to then like heart disease? Like what does that kind of progression then look like for the heart?
So when you have blockages, so your heart is demanding and you're not able to meet the demand. So as a muscle, because you're not providing that, we see a damage. So the heart gets weaker and weaker, right? And that's when you tend to go into heart failure. If we identify them early, sometimes, again, fortunately, unfortunately, if the blockage happens all of a sudden, people come with heart attack. So
Mhm.
obviously, we have a very good STEMI program throughout the US. We have what we talk about a door to balloon time. So when they come in, we have 90 minutes. So once they hit the ER, you do an EKG, you see ST
Yeah.
elevations. That means that the blood supply to that part of the muscle is cut off. You take them to the lab and open up the artery and put a stent. Or if they're having multiple blockages, then you talk about possible coronary artery bypass surgery. That's called, the common term that we use is CABG. So you want to identify it early on so that the muscle doesn't have an irreversible damage. When irreversible damage happens, that means that you don't pay attention to the signs that you're having. You ignore, or say, a lot of times I see patients who had chest pain, like, again, it's not their fault. Sometimes they have atypical chest pain. They
Yeah.
consider that, oh, I had heartburn, like, you know 3 nights ago. It was burning very, it's kind of there for like 4 or 5 hours. I felt uneasy, and then they don't show up, and then a week later they come with heart failure. So those
Yeah.
are things that, we want to educate people on, so that, if they have risk factors, if they have symptoms like that, they need to present. Because if we identify the process early, if we know that they have a blockage, whatever, if someone is a diabetic and having atypical symptoms, right, not typical
Yeah.
chest pain, they have very atypical presentation. That means that they don't have a classic chest pain like the crushing chest pain. They might just feel fatigue, they might have some shortness of breath. So we can identify those by doing a stress test. Once we identify the ischemic heart disease with stress test, we do things to see what we can help them, whether they need revascularization. That means that having retaining the blood flow to the heart muscle, right, by either
Yeah.
placing stents or by doing a bypass surgery, whatever it takes to restore and prevent further damage from the heart muscle. The problem happens is when they don't come, and then when the repeated insult happens, and when we
Mhm.
come to a point where, the muscle is necrosed, at that point, they end up with heart failure, and
Yeah.
that
Yeah.
might be more or less irreversible at that point of time.